Hello students, today we will be continuing our class with block 4, which talks about the patient and practitioner, relationship and health. Okay, so in this unit, there would be, in this block, there are 3 units. Unit 10, okay, patient, practitioners, communication, then health, compromising on health, enhancing behaviors, then we have health. Okay, so let's discuss in detail. In unit 10, we're talking about okay, patient and practitioner communication. This particular topic it's talking about okay how or what should be the communication between the patient and the practitioner or the health professional. Okay, as we know, most of the times when we get into a health professional into his clinic, okay, the way the doctor talks about or makes a conversation with the patient depends on okay how the things are okay, carried out. For example, the patient might have entered initially with some problem that is symptom or illness that you would be visiting a doctor. So based on okay, the conversation, so how conversation is going on between the patient and the practitioner is going to decide okay the further course of action. Okay, so how this particular patient has been received by the doctor. So how is making the conversation or the way is okay, talking about. For example, when doctors, especially, and also we as a practitioners, okay, we establish a small rapport with the client or the patient who is visiting us, so that we can make them come out of okay what all the okay, barriers they have or what are the misconceptions or they might have had some impressions about the doctors, treatment, and especially the illness what they are going through. For example, if it is a chronic, so they may be thinking that okay, if not they get treated, so they may not be responding properly to the doctor. So this is how it depends. So the nature of patient and practitioner communication. So unless and until the communication is okay, good enough, where a detailed conversation is established between the doctor and the patient, okay, the treatment is not going to extend further. Okay, so the patient and the practitioner relationship has to be so good that the patient should feel satisfied, okay, and you should get a sense of okay, being cared or taken okay, into account. So unless and until he thinks that okay, the practitioner is not taking care of him or he may not okay be okay consciously doing that particular thing, but they may be busy and it may be a routine thing for okay the practitioners or the doctor. But the patient who is attending for the first time, it's signs, symptoms, okay. So he thinks that okay is not attended properly by the physician. Maybe physician might be doing this the job in a very casual way. First is job or as a professional, our job is to take care of the client. to listen to them. So if, for example, in a conversation where you might talking about, okay, what are the symptoms in a direct way. So maybe these things may seems to the practitioner, okay, especially the practitioner's behavior to the particular client, that the doctor or the professional may not be much interested. Okay, he is so busy, he's not talking properly and all that. Okay, so this is how. So the interaction has to be so good that my particular client should get a sense that he is taken care or is attended properly. So small rapport has to be established so that the patient, he feels comfortable. He comes out of, okay, all the misconceptions what he had, and where he feels free to share what actually is bothering him. So this is about the nature of the patient and practitioner communication. In factors affecting the quality of, okay, patient practitioner communication. Okay, there are certain factors. Okay, according to Smith and Simning. Okay, so these include, okay, not following the prescription treatment. Okay, so for example, if the patient has been prescribed, and if the patient is not following the prescribed treatment or waiting too long with symptoms before contacting the doctor. Okay, so maybe if my particular patient, if he's not, okay, turning up at the early stages of illness, and if he's waiting too long, okay, so these are certain factors which affect the quality of patient and practitioner, okay, communication. And insisting on laboratory tests, medications, or procedures, okay, where the practitioner thinks that, okay, they are not needed. But if the patient is insisting on these particular things, okay, then requesting that the doctor certify something. For example, they might be coming or visiting doctor with an intention that they should get some certificates, where the actual problem may not be existing, but if they are thinking that, okay, or if they have come with an intention to get some certificates, okay, there also this particular communication between the patient and the practitioner can get affected. Okay, then making sexually success, okay, suggestive remarks or behavior towards the physician. For example, we talked about, okay, what all can be from the practitioner in the first part. Okay, maybe if they are not attended properly, if there is no proper conversation, okay, and if the practitioner might be a little bit direct without beating around the bush, and if he's asking for what are the symptoms and all that, there they were thinking that the doctor or the practitioner might be very busy, have little time to attend, and so this is how they may get affected. But these are the factors from the patient side which can affect the quality of the patient and the practitioner communication. So if the patients have this type of, okay, suggestions or behaviors that are inappropriate towards the physician, can also, okay, affect the quality of the patient and practitioner communication. And next we will talk about the effect of, okay, poor patient practitioner communication. Okay, so when there can be a poor communication between effect of, okay, poor communication between patient and the practitioner. Okay, for example, when there is a dissatisfaction. So as we know, we talked about, okay, patient visiting the professional for seeking some advice or seeking a help, and when he, okay, feels that you have been not attended properly or you have not taken care properly, and also when there is no progress. Okay, when this particular client is not satisfied the way the treatment is going on, can affect or can become, okay, poor patient practitioner, okay, communication, that is non-adherence. Okay, so dissatisfaction with the treatment. Okay, then factors, there can be certain factors which can affect, okay, this particular adherence. Okay, for example, okay, how a person interprets their illness, their treatment, and their symptoms, and how the practitioner have responded to them. So how he is trying to elaborate. For example, if there is no proper or enough discussion, or where there is no detailed explanation of what can be the reasons, what is the particular type of illness the patient is having, what can be the symptoms, so how the treatment would be going on. So if there is no such, okay, interaction between the patient and the practitioner, so there can be a non-adherence or there can be a dissatisfaction. So there is or need for, okay, a interactive mode where the practitioner is responding well to the patient as well as is trying to give a detailed description of what the illness is, what might be the symptoms, okay, so what should be the treatment, okay, so how long the treatment is going to be, okay, taking the patient into consideration, discussing about the treatment procedures, the alternatives available to the patient, and also how are the side effects are going to, what and how they are going to affect the normal, the functioning of the patient. So when these things are discussed and conveyed and made aware to the patient, so this is how the interaction or the communication between the listener and the patient is going to be a satisfied or successful. Okay, then practitioner's style and behavior also. For example, when practitioners are busy, as I said before also, and when they start talking or directly when they point out what the symptoms are. So this is how their hurriness or when they don't have enough time or when they're asked for certain explanations without listening to them, okay, or just by listening to the symptoms and if they're concluding and not taking the patient to give elaborated explanation about what exactly bothering them can be misinterpreted by this particular client or a patient as there is been no proper time given for this particular patient to explain about himself, and they think that okay they are not taken care or they are not given much importance, okay, to talk about them, explain about them. So this is how certain practitioners' styles can also be an barrier for this effective communication or interaction. Okay, and also the way they address or generally the way they talk about the general words can also be sometimes problem. Okay, so the way they behave with the patient, okay, which can be in terms of the way they try to communicate, the usage of certain words, medical terminology also can lead to dissatisfaction with the communication which is going on between the the patient and the practitioners. Okay, then how to improve this? How to improve this patient and practitioner, okay, communication. Okay, so there has to be certain provisions like training practitioners and especially so formally they would be trained at the time of okay their leaders also, but the professionals especially they should be okay given certain communication skills, okay, and also to involve especially the patients in decision making. Okay. Although the decision would be taken by the practitioner, but if they try to involve patient and explain them what the treatment is about to be going to be, and if they try to ask for certain alternatives if required by the patient, so this is how they're going to be a good patient and practitioner communication satisfaction. Okay, so certain communicative skills has to be taken care by the practitioners. And also the effective non-verbal communication. Okay, we talked about okay the way they're communicating verbally. Then we talking about effective non-verbal communication can improve adherence to treatment. According to Dai Matthew 2004, some of the behaviors that practitioners can apply or they can employ to improve communication and in which turn can increase the adherence or satisfaction in the communication. For example, listening to patient, asking the patient to repeat what has to be done, keep the prescriptions as simple as possible. Yeah, this is the thing which we commonly look at. Okay, where the prescription is written in such a way that it is not a where a normal person will not be able to read, and by looking at that, okay, they will not be able to get actually what problem they have and what are this. Okay, so this is how the prescription can be made as simple as that without any okay the technological terms which the patient may not be aware can make it more satisfying. Okay, give clear instructions on the exact treatment regimen, okay, preferably in writing. Okay, make use of special reminder, okay, fill containers and calendars with regard to taking of medicine. Okay, call the patient if the appointment is missed. Okay, if they have missed an appointment, so if practitioners so they can make a call, okay, where they can remind the patient that they have missed on some appointment. So this is how they're going to be get motivated to come back to treatment and visit the practitioner. Prescribe a self-care regimen in concert with the patient's daily schedule. Based on the daily schedules, if they can prescribe a self-care regimen, then emphasize at each visit the importance of adherence or coming to the treatment. So what is the importance? So in what way the treatment is going on? So how the implement is going on? So this is how you try to motivate. So get the frequency of visits to adherence needs. Okay, then acknowledge at each time the patient's efforts to adhere. Okay, so we are also appreciating their efforts. Then coming back, involve the patient's spouse or okay the other partner. So whenever possible, provide the patient with instructions and advice at the start of the information to be present. Okay, when providing the patient with instructions, emphasize how important they are. Okay, use short words and short sentences. Okay, use explicit categorization where possible. For example, divide information clearly into categories of etiology, what the illness, what can be the causes, okay, what is the prevalence, so it's called as etiology, then treatment, so what is the standard treatment for that particular illness, or the prognosis, so how before the disease is to be identified or with help of which test, okay, so the prescribed test and etc. When you make this particular patient clear about this, okay, so this is how they're going to get motivated and they're coming to treatment. Okay, repeat things where feasible. When giving advice, make it specific, detailed, and concrete as much as possible. Find out what the patient worrying about. Okay, do not confine yourself merely to gathering objective medical information. Okay, which stresses that yes, information has to be gathered to arrive at, for example, the particular symptoms. Okay, the signs and symptoms, so that they arrive at the conclusion or identification of illness. But if it can be integrated with the general things also, where you try to make a particular person okay feel being that involved, okay, what we generally call as okay a rapport kind of thing, where you asking about okay these are things which may not be necessary but that makes the person the patient okay feel little bit of comfort and where you can express more open. Okay, find out what the patient's expectations are. Okay, so this is very very important. We're trying to find out so what the patient is expecting from. Okay, so what he is expecting from. So how the things has to be a plan, because if you have a huge expectations thinking that okay, maybe at one point of time or one or two visits illness is going to be completely cured. So this is how they have expectations. So you make them aware about the severity particular illness they are having. So how much of the time it is going to take, the condition of or the severity of the illness has to be explained, so that they come out of it if they have high expectations, or they plan, or they act according to the severity. Okay, provide information about the diagnosis and the cause of illness, adaptive friendly rather than a business like attitude. Yes. So this is very, very important. So when we're talking about the health practitioners, okay, so this has to be taken care. Okay, so it is for a business kind of a model, but still that has to be completely not as a business model, because we're talking about the humans, their feelings and their emotions, their okay worries, which is bothering them. So if we can give a friendly touch to that, a caring, warm relationship. So this is how it's going to encourage my particular client to turn up again. Okay, avoid medical judgment. That is okay. If there are any communication with regard to okay technical terms and etc., which the patient is not aware, or if we cannot get that particular things, so try to avoid those usage of okay technical terms. Okay, spend some time in conversation about non-medical topics also. So this is very, very, very important. Okay, so some practitioners, especially, they have this type of okay practicing style where they talk about okay, not only about the symptom or the illness related information, but they're also trying to talk about okay, what all can the other causes which can contribute. So non-medical topics also they try to talk a little bit with this particular patients, taking time for them, okay, giving time required for them. So discussing not only about the medical symptoms, science, etc., but also about non-medical certain topics also can make the client feel cared and taken care of. So this is how these things will make relationship okay more satisfied. Okay, then certain things like okay tailoring the regime, that is if the patient in which the activities in the treatment are designed to be compatible with the patient's habits and rituals. Okay, so when you try to prescribe or the treatment is designed or it is planned according to the patient's habits and rituals if they have anything. So if those things are not getting disturbed, so this is how the treatment is going to be successful. So tailoring the regimen, then providing prompts and reminders. So this is very, very important. So because patients being very they're busy with their okay normal jobs, etc. So providing prompts and reminders will help out okay this clients or patients to turn up, because that is going to give them a sense that they have been taken care. So it's not from the business point, but also from making a friendly relationship where the care and is been taken care. So when they are missing out on something, or if there is a reminder, so this is how they are going to get motivated. They're going to come in self-monitoring, so helping clients or patients to self-monitor their activities with according to the treatment which is going. So, for example, like eating habits, okay, so working styles, etc. So, at what time and how, what it has to be taken. Okay, so all this, if we encourage them to self-monitor themselves, so this is going to give us okay improvement in the treatment process. Then behavioral contracting. So here the practitioner, the client, and the family members can negotiate a series of treatment activities. So this is very, very, very important. And goals in a written and specified rewards the patient will receive for success. So what behavior is appropriate, what behavior is expected, what support has to be given or provided by the immediate family members, and after successful attaining of certain specified tasks or goals. So what patient is going to do? So we need to reward him a kind of appreciation, a motivation where we can encourage the student to, where we can encourage the patient to carry forward with this treatment. So behavioral contracting. So what and how the treatment is going to be, and also how the family is going to get involved, and what type of support they have to provide or they have to give to the patient so that he get motivated. So how he should be rewarded. So rewarding in the sense, okay, it can be a small appreciation that the patient is getting motivated to carry out with the treatment going on. So all these factors are going to make the communication between the patient and the practitioner, okay, adherence, satisfied, so which will make this particular the process of treatment to get carried forward. So if the patient is not satisfied, the way the conversation, the communication is flowing between him and his practitioner, if it is not very satisfied, then he will drop in between the treatment which is going on. So this is how it can be a failure or it can create a much worry for the patient because he's having the signs and symptoms. So he's having certain illness which is not cured and which is dropped in between. Okay, then we will talk about unit 11. So unit 11 talks about health compromising and health enhancing behaviors. Okay, so we're talking about okay health compromising behaviors like tobacco and smoking, its abuse, alcohol abuse, drug abuse. As we know, the word abuse implies that then certain thing is taken, like for example, you can take hormones, tobacco, alcohol, the drug, even they have been taken in a more and regular than required or than prescribed. So this is going to be called as an abuse. So we are going to look at okay, tobacco and smoking abuse. Okay, so generally, so what makes them to use more than the prescribed or more than the required? Okay, which it's called as an abuse. Okay, the first thing is about reinforcement. As we know, so when there is a reinforcement in terms of okay, positive or negative reinforces. For example, reinforcement is when the consequences of behavior are strengthened. So once they have taken these particular substances, when they started using this, okay, when there is a reinforcement of the consequent behavior. And if this particular behavior is positive, so which is giving a pleasure, okay, obviously pleasure is going to be increasing the strength or the intake or the quantity they are taking as well as the frequency how they are taking these substances will increase because it is providing them with a pleasure. And if it is a negative consequences, for example, here it can be where they are talking about withdrawal symptoms. Okay, if they're not using certain substances and where the body is giving certain negative side effects. Okay, so because to avoid this type of okay negative consequences, so they are again getting into usage of these particular substances where they are very much dependent on them. Without the substances, they are not leading the normal life. So this is called as okay abuse. And avoid withdrawal symptoms. As we talked about, okay, to avoid withdrawal symptoms. As we know, withdrawing certain substances on which they are dependent. Their dependency, as you know. So without this particular chemical compounds, okay, they're not going to get lead the normal life because it's going to have effect on the functioning of the body. So to avoid, if they cannot face the withdrawal symptoms, first they are negative consequences which patient or a client they don't want to face them. So to avoid them, so they are again getting into usage of these particular substances. The substance related cues, for example, there can be certain cues which can trigger these particular persons to again get into, or it will motivate or it will trigger this particular persons to have these particular substances. For example, the sight, the vision, the smell. For example, when I talk about sight or the location, the particular location may remind this particular people certain incidents which have happened to them, or it can be the place associated with pleasurable certain things. So which will trigger this particular persons to get that particular thoughts of having these particular substances. This is how they are again taking these substances. So smell, vision, thought of substances. Okay, this can be associated with this particular habit or taking of the substance because of classical conditioning. So there is a condition between the place and this particular substance because that particular place, smell, okay, they are giving this particular pleasure thoughts. The thought of having pleasure. So this is again triggering the person to take it. Then genetics, for example. So when there is predisposition in terms of heredity, so this heredity also plays a role in making people to get used to this particular substances. For example, research was done on the identical twins and fraternal twins. So where the identical twins were having this type of okay provocation, or where they were having found to be okay, towards addiction or usage of certain okay substances or products, as it was observed in a research compared to that of fraternal twins. So this says that there is a genetic predisposition also for getting or looking towards this particular substances, using them, and depending on them. So where the call substance dependence, then it is taken to a form that they are taking in more quantity and also more frequency. The frequency is also increasing because the body is getting tolerant. The body is getting adjusted to this particular chemical compound. This particular chemical compound is no more giving them the particular initial trigger or the effect what they used to get. As the body is getting adjusted, getting tolerant, so this particular substance has to be taken in the more dosage and more frequently. So this is how they are getting into this kind of abuses. So tolerance of the substances. Okay, so these all are the causes for substance abuse. Okay, as you know, tobacco and smoking abuse. So initially they start maybe because of peer pressure, or if they think that it is a mannerism because of the social media exposure. So aggression and certain behaviors like smoking, etc., which are together shown as a kind of a mannerism where being aggressive or being a hero kind of a thing. So these particular things make okay, impressions, especially on teenagers, to get into these substances initially, and for a period of time becomes them to take to a quantity where the body is not responding to the required or the usual intake. So it is demanding more and more dosage as well as the frequency they are increasing. So this is how they're getting into the abuse state. In alcohol abuse, so alcohol abuse can also be because of peer pressures. So they have started using this and they have come to a stage where they are not able to live a normal functioning. because the physiology of the body is getting disturbed, okay, without this particular chemical compounds. So they have to take these particular chemical compounds because the body got so much dependent on these chemical compounds. So when they are not given or withdrawn, so it is started showing some negative consequences. Okay. So then drug abuse, as you know, drug abuse. So it is very, very getting in news. So each and every day we find okay so many incidents where certain chemical compounds which are illegal or which are not prescribed, non-prescribed for our medical usage, but people start using them. So they get so much addicted to these particular chemical compounds. So without using these chemical compounds, okay, the normal function will be getting disturbed. Okay, so certain compounds are used for getting trigger. For example, caffeine, cocaine, and all that. Okay, they give a activation kind of a thing. Then we have depressants, so which make the people get into suppression and a relaxing effect. So this is how certain chemical compounds are used initially to get rid of certain depressions and all that, but they get into the usage to certain extent that they are so much dependent because if they're not taking these chemical compounds, it is going to affect their the normal function. Okay, then we will talk about health enhancing behaviors. Okay, health enhancing behaviors. So these health enhancing behaviors are behaviors which are okay, promoted, which are taken up by the people to increase health, and they are aimed at prevention of ill health. For example, nutrition. So when we encourage people to take nutrition or nutritive food, okay, so this is going to prevent ill health and improve wellness among the people. So nutrition can be given through the healthy food or nutritious food. So nutrition in terms of food can be of five types like carbohydrates. Carbohydrates again two types like glucose, okay, found in animal products. Then fructose. Fructose is a table sugar or what we use for our daily purpose. Okay, so it is extracted from fruits and honey. Okay, then fats and lipids which are required for our body metabolism. Then you know the proteins which are required for amino acids, etc. Then we have vitamins. So vitamins can required for functioning metabolism of the body. Then minerals like calcium and phosphorus, which are components of bones and health, potassium and sodium in nerve transmission. Iron helps in carrying oxygen in blood. So iodine and zinc help in body function. So this is how, with the help of food, we take okay, five components which are okay, carbohydrates, okay, lipids and fats, okay, then proteins, okay, then vitamins, then minerals. So when we take these nutritions okay, with the help of okay nutritious food, so our body is going to get healthy, okay, and we're trying to prevent ill health. Then weight control. So weight is the thing which is bothering most of the population these days because of certain factors like where we are, okay, taking junk food or fatty or oiled food. So not much care is taken care about that because of inheritance also. So this is how weight control. So weight can be controlled by controlling the food we are taking and also with help of regular exercise or physical activity. So there is a concept called body mass index BMI, so which is going to tell how much you are overweight compared to your body. So height and weight of the body is going to tell you okay, so how much you are overweight, or is it with a normal range, or is it low can be required. Okay, so each and every smartphone these days have this particular BMI index. So each and everyone can check out so BMI so that they can come to know are they with the required weight or are they low having weight or above, which is called as overweight. So overweight can be a gate, a reason for many other illnesses. So this is how weight control has to be taken care, and it is very easy these days. As I said, smartphones are having this particular feature where we can check your BMI. So based on that, our eating habits has to be controlled so that we have control on these particular illnesses or where we can prevent illnesses. Then having sleep, adequate sleep. So it is prescribed that it is to have 7 hours of good sleep. Okay, so this can range or this can depend or change from person to person. So 8 to 9 hours, they said at least 7 hours of sleep is required, which we're talking about. Okay, not lying in the bed, but having a good and sound sleep. Because sleep is a metabolic activity where our body is completely getting rest. Okay, where it is preparing itself for the functioning. So sleep has to be there because if sleep is getting disturbed, if there is inadequate sleep, it is going to have negative impact on the performance, that is working of the person, not able to be concentrate. Again, judgment, perception can also be getting affected. So this is how food have a very important role because it can also lead to certain sleep disorders also. Okay, so to work effectively to fight infections, because we're talking about the immune system, the immunity is also getting disturbed if we are not having proper sleep. So to fight infections, support metabolism, and also to provide energy. So as we have a restart button for electronic gadgets in the same way, if the body has to get restart, so proper and the required amount or quantity of sleep has to be given. So this is also one of the best reasons for our promotion of health behaviors. In prevention of illness, to prevent illness, health can be okay, taken care, and illness can be prevented at three major levels. So which can be called as primary level, secondary, and tertiary level. So primary level is that where an individual, so individual by himself, if he is taking care or if he is aware of what illnesses or symptoms or what is facing, what is bothering him. For example, dental problems, etc., or certain symptoms like pain, etc. So initially at the individual level, if they are taken care, so that they can come out of these things by taking the proper action. So it's called as the primary level. Secondary level is where it's been little late. The action has to be taken and identified by making a diagnosis kind of where it's like an early stage. So primary level at the individual level where they are seeing certain symptoms. The secondary level is that identification, but through proper diagnosis at an early stage. So so secondary level at early stage is also going to give good results because at early stage, if certain illnesses are taken care, if they are addressed properly through medication, so they are going to get cured. And the tertiary level is where it is already crossed the the early stage, so they have arrived into or they have got into the advanced stage where a serious action has to be taken care, and also there is certain difficulty in making, or sometimes it is irreversible. For example, it cannot be brought back to the normal functioning. So this is how tertiary level is a last stage where they have already crossed this early and got into advanced stages. So treatment is also getting a little bit difficult, and also there is no guarantee that there can be okay reverse to the or get back to the normal function. Okay, so this is with regard to treatment, okay, or levels of prevention, primary, secondary, and tertiary. Okay, then we will talk about okay health promotion. So health promotion can be done with the help of mass media. Okay, so our government is also making so much of effort to create awareness about the different illness, okay, and how these illnesses can be prevented, so by adapting certain healthy behaviors, okay, and also they're talking about okay how this particular the preventions can be identified at primary, secondary, and tertiary levels, and especially they're trying to promote okay the primary prevention because it is the person or it is the individual if he is able to identify any malfunctioning of any of the parts or body parts, if there is any inconvenience, if certain body parts are not responding or there is anything that's bothering him, so if they try to respond immediately and visit the doctor, so this is how. So it is going to be cured without okay, taking much time. And also, if they are failing because they're thinking or they're associating with the general activities, like for example, if a pain, they associate with any other work, for example, like maybe the working style, and if they're thinking that okay, the pain might be because of a little bit of more stress what they have taken at the workplace. So this is how if they are feeling at the primary level, so at least when it is associated with certain other symptoms, okay, one symptom is now getting associated with many other symptoms. So at least they should get bothered or aware, and if they can make a visit to a practitioner. So this is how the illnesses are going to get identified at the early stages. So early identification is very, very, very important where the treatment is going to be successful. So the normal health can be reverted. There is every possibility that illness can be addressed. And especially as we talked about again, tertiary where almost all much damage has been done, and there is no guarantee that they are going to get reverted to the normal conditions. Okay, then elements of health promotion. So there are certain elements. Okay, for example, good governance for health. Okay, the government policies, health department especially, they're making so much of efforts to create awareness with regard to different illnesses, causes of illnesses. For example, iodine salt was at one point of time, so it was made as a compulsory. So this is how government also initiating so many and providing health literacy. So providing them with adequate knowledge, skills, and information. Okay, so that they can provide this information to the normal people, and they get aware, and also they start using or taking nutritious food. Or for example, we talked about the iodine or iodine salt. So making usage of iodine salt. So when you can create awareness about requirement or the effect of iodine in the body. So how is it getting affected? So how it is necessary for the normal functioning of the body. So this is how if you give the health literacy or creating awareness among the people, so they are going to get into practice. In creating healthy cities, okay. For example, municipalities. So when they have this particular okay urban planning and measures to prevent illness in community needs, okay. So if they can prevent or if they can create awareness, for example, we talked about okay, corona. So corona prevention, they talked about how it can be prevented. So in the major cities and also at the rural. So this is how okay the municipalities or the concerned okay, authority if they are taking required okay, efforts like okay, urban planning and measures to prevent illnesses, okay, community needs, Okay, so this is how creating healthy cities. Then promoting health and well-being. So health and well-being is promoted in health society. It needs to promote in schools, colleges, organizations, and communities. And we know that as part of school, education, healthy behaviors are also taught to them. So this is how we make them be aware of what are health behaviors, so how illness can be prevented. Okay, then behavioral and cognitive methods. So behavioral methods, they're talking about eliminating certain risky behaviors. Okay, risky behaviors, so which can make a person get into healthy and prevent illness. Then cognitive methods, where we are trying to change the thinking process of the particular client or people towards the healthy behaviors. Okay, for example, self-efficacy of a person can be increased for quitting smoke. Okay, so this particular social cognitive theory states that okay, determinants that translate the knowledge into effective health practices. The determinants include knowledge of health risks and benefits of health practices. This is how they are going to is the self-efficacy. The self-efficacy in turn act as controlling for one's behavior. So this is how you get motivated to control, or to come out of certain unhealthy behaviors. So by changing the thinking process, which will ultimately boost the self-efficacy of the people. Then promoting health in schools, as we talked about, the focus of schools, for example, like self-caring and caring for others, being in control over one's life while making healthy decisions, creating policies or offering services that are conducive to health, being able to build capacity for education, food, stable ecosystem, sustainable development, providing knowledge and information to prevent the leading causes of death such as use of tobacco use, lifestyle use of alcohol and drug, prevention of HIV/AIDS study, promoting safety behaviors to avoid injuries and violence. Okay, schools also play a role in influencing health-related behaviors by enhancing knowledge. So knowledge is very, very important because we talk under cognitive component also. So having knowledge is going to improve the way they are thinking or what they have towards this particular behavior. Skills supports attitude and values. Then about work site and community-based wellness programs. So at workplaces, certain health benefits like health-related programs, health-related policies, health benefits, for example, providing them with certain insurances, health insurance, or where they have this facility to take treatment, can also encourage people to okay visit certain hospitals or get into this health related behaviors. Then environmental support, for example, the environment to protect and enhance health of employees in terms of physical factors and nearby workplaces. So environmental support can also be given to increase work related okay improvements. Then community based wellness programs. Okay, community, as we know, the facilities are given by the okay governments, concerned authorities, so which are aimed at improving the wellness of the people. Okay, community based health services like primary facilities and subsystem of overall health systems, like we have primary healthcare centers, we have health workers, so we have certain staff which are particularly used for this health related activities. So government is creating much awareness to bring a change to the community. So workplace and community based wellness programs. So these all are designed to promote healthy behaviors. Okay, I hope you have understood this particular blog about okay, so particular blog, that is blog for patient practitioner relations and health promotion. So with this we have ended this particular class, and we will continue the further classes.